Welcome to Beauty Times Medicine, Galderma's video and podcast series that keeps you informed about the latest innovations in dermatology and aesthetic medicine. Today's guest is no one else than Dr. Andreas Nikolis. He's based in Montreal, Canada. He is a board-certified plastic surgeon, actually on multiple continents, and is internationally recognized for his innovation with injectable aesthetics. As a faculty member of our Galderma Aesthetic Injector Network, also called GAIN, he's been instrumental in improving patient outcomes and driving advancements in the field. Dr. Nikolis, welcome.
Thank you. It's a pleasure to be here.
Also for us. GAIN, 10 years old. I think you've been along all the time. What's the journey been like?
It's an incredible journey. It's actually like seeing your teenage daughters turn into young women. We started with a platform that was aimed at medical education, and it developed into something much more. It now reaches everyone globally. It touches on education based on age, gender, ethnicity. We've reached out on taking product and taking them to the next level in their uses, advancing techniques. It's just the evolution of aesthetics that happened over these last 10 years, and we're just getting started.
And you've probably been everywhere. It's been, I don't GAIN, how many cities and countries and continents?
And that has been one of the best experiences. Seeing how this information applies globally. And you can see that the information is very important. Some of the key information applies to everyone. And then we become region-specific, so those sites are incredible.
It must also be very special for you because in the process, you probably trained a lot of experts, physicians around the world. You probably have seen them grow up with GAIN as well, haven't you?
That's an excellent point. We start these individuals very early on, strong science background, techniques. We videotape them, we give them feedback, and they become masters of injections over the 5, 7, and 10 years.
Yeah, I think as a training, but I see more and more innovation coming. Is it now an innovation platform?
It's an innovation driver. You know, when we travel all over the world, the hardest questions come from the people sitting in the audience. What about this? Did you think about that? Have you ever tried this? And then we have to go back and think about where's the data? Are we missing data? Should we plan a study, execute the study, and come back to those individuals with a response? They drive innovation.
I remember sitting in on one of these events, and I think you said something like you can't outrun your genes, but maybe you can modify the journey a bit. How did that come up, so to speak?
You know, it was interesting. Many of us treat the same patients over many years. And what we realized is that the product requirements change, the patient's needs change, and of course, our techniques have to evolve with the changing patient. We need to be able to identify that the patient is changing, and we need a wide product portfolio to allow us to change the products in the same patient, treating the same regions. Their skin thins, we have products for that. Their skin is thicker in other areas, we have product for that. They have skin laxity, we'll take care of that. So it's the evolution of seeing the same patients for 5, 7, and now 10 years and documenting their aesthetic journey that has changed the way we teach.
You say that patients should also bring pictures of their parents. The whole idea and the photos, the systematic use of them, was that there from the beginning, or is that something that you can see this program has helped influence?
Absolutely. In fact, there was a program called Generations. And what we did is we took almost 10 sites all over the world, and we treated 3 generations and even 4 of the same family, the daughter, the mother, the grandmother, and even the great-grandmother. We started identifying similarities in the aging process, but then we saw a little bit more. What can we do to actually prevent some signs of aging? And this Generations project allowed us to start treating areas even earlier than we would expect. A 30-year-old getting injections in the piriform aperture slows the descent of the fat pads. We wouldn't have known that had we not seen the mom and the grandmother evolve. So we applied all this together, and these events changed the way we actually practice aesthetics in our office.
I've seen in multiple meetings now that you are really an expert in how you inject, with what you inject. I know it's a bit controversial because some like needles, some like, but how did you get into that area?
When we started, we actually just used what was given to us. And then we saw that in different parts of the world, they were doing things differently. Were they wrong or were they right? So instead of using needles, they were using primarily cannulas. We identified that using needles versus cannulas in certain areas can give you the same response, but in other areas can give you a better response if you use one over the other. Then we started looking at where the product goes when you use these devices. And we found that you can actually completely and precisely place the product in different areas by using different tools. The ultrasound is a wonderful tool. It can help us with injections, but it also helps us manage adverse events. It allows us the insight of seeing what's happening under the skin and also knowing if a patient's had previous treatments. So the technology aspect was not there. We grew gain with the changes in technology that became available to us.
It looks like from some of the studies you made that the science is getting pretty clear where and when you use. What's your sense about that?
Absolutely right. As long as you can master one of the two tools, then you expand to the second one. And then you yourself are able to identify whether or not one is better than the other. For instance, in the teardrop, when we launched iLight, we used needles and cannulas. We showed that with individuals who are comfortable with both, you had the same outcomes. So this is what the key is. Get comfortable with one, then master the second one. And you can probably precisely place the product exactly where you want to.
One area where you've also been very pioneering is, of course, lots of interest around the eyes, under the eyes, mid-face, but the lower face seems to be an area that was, I wouldn't say forgotten a bit, but it's an area that both with research and I understand with new product developments, it's an area you've been really at the forefront of. Tell us a little bit about that.
I think that's a wonderful question. The lower face was forgotten, specifically the chin. And surgeons, I'm a plastic surgeon, we only had chin implants. So everyone who came in got a chin implant. We needed robust products who can handle the shearing forces of the chin that could withstand pressure and give us longevity. We had an advisory board years ago in London. We asked for this particular technology to come forth. Several years later, it did, and it's now changed our practices. The lower face creates equilibrium for the face. If you're too short, we can make you longer. If you're too retruded, we can bring you forward. If you want a stronger male chin, we can give you that. We can sculpt through the eye of a needle with these new products. This was never available to us before.
How do you, is it an enormous education event? Do you use GAIN as a, how do you roll that out, so to speak?
GAIN is the ideal platform for these kinds of teachings. We begin by developing the principles and following the principle of art. Assessment, assessing a lower face, very different. Anatomy of the lower face, very different. The rheology and the range of product, extremely different product, new category. And then we developed specific treatment protocols for them. So we used GAIN as the platform to educate them on all these sequences before they actually place the needle in the chin. We can predict outcomes. We've shown them males versus females. We can change the shape, the height, and the projection now in a very reproducible fashion.
If you now have discussions with your patients, how do you guide them, whether they can be treated with a product or they would need surgery? How's that discussion going?
You have a patient that comes in, they want only injections, and you have another patient who comes in and they only want an implant. Well, guess what? They're both getting injections, because even the patient who wants an implant, through the injections with this technology, we can actually show them what the result will be. Now they have the luxury of designing their own chin with us, and it makes it so much easier to choose a definitive implant at the end. So it's actually opened up a whole new world of patients we never had before.
You have words like major rejuvenation coming up, and it's almost a bit scary. Do you think that when you use a word like that, it almost sets some expectations for significant change, rejuvenation, but how do you manage these expectations?
We're now going through a revolution in aesthetics with the rapid weight loss phenomenon that's happening with medications. We now have to promise major rejuvenation to these patients. These are very different patients than we've ever had, and we're able to do it now, but we require time, a simple thought process, and a plan, a treatment strategy, and we have the tools to do it. So this is how we now do it. We explain, we show, and we deliver.
Do you think it's clear to patients when they come to your clinic initially that maybe this is not just a one-off? Or how do you get from a one-off to a series and plan? And how do you have this discussion with the patients?
So 2 types of patients, treatment naive and treatment existing patients. The ones that know about aesthetics are easier to deal with. The treatment naive patient, you have to walk slowly. You begin with small treatments, you show the result, you gain their confidence. You also show them what you've done with other patients so they understand, and you move the evolution over time. So giving them examples, clear examples, and that's what the GAIN platform is so great at. We've created so many patient cases that we can help educate everyone all over the world, again, based on age, gender, and ethnicity. So they will see, do you want this or not? It's almost like shopping through a catalog, but individualized to each patient.
Kind of a common theme is aging. How often is that the entry level when they have discussions with you? Is that how I want to age, or I'm seeing the first signs of aging? When does the word age, so to speak, is that almost whatever age they enter at, is that the first discussion?
It's almost always the first discussion. Now, the advantage is we have social media, and that's been a good thing and a bad thing. It's up to the professional in front of the patient to reset the expectations and to actually explain what natural aging is. We want natural aging. We don't want unnatural aging. We want everyone to evolve properly, but we don't want them to look run down. We don't want them to look tired or sad, and we don't want their skin to suffer. So we have the tools to actually make them age gracefully, and we have the tools and the knowledge to teach this across the world.
Well, Dr. Nikolis, it's been an absolute pleasure. Thank you so much for sharing your expertise and your insights. And I think we can only say keep going with the same speed. I think a lot of people will benefit from that, also your patients, not least. So
thank you for having me. Thank you. It's been a pleasure.
So thank you for joining us this episode of Beauty Times Medicine. We're, of course, excited to continue to bring you expert insights and leading voices, as we had today, from the world of dermatology and aesthetics. Be sure to follow us on our social channels, and now, yes, also on Spotify for more episodes and more updates. Stay tuned.